When you're working on like an Achilles tendonitis type situation, a lot of times the two levels of the calf provide for a little bit tightness, a little bit of scar tissue. You can have both of them. In her case, she's got the gastroc a little bit tight on top, but she's also got the soleus there. So we're going to work on both of them. And when we work on them, we want to try and lengthen them as much as we can. All this tightness and pain that's here, we're going to be working on it from that top down. So this is more or less like ART stuff. So I'm going to scooch down just a little bit this way. And essentially, you know, the calf itself, obviously it's already tender. So you can see her squirming around. I don't know if you can kind of see me flopping over that. That's a little bit of a band of stuff we need to work on. And this side is not as bad, but still tender to her, a little bit lower on this side. So when you do ART stuff, you know, the best way to explain it is you're going to put tension onto this muscle here, and I don't want to be too deep because if I push too deep, it's just going to be hurting her. There's no reason. So and now I'm going to have you flex your foot this way. Yep, just like you're letting off a gas pedal, and just getting a lot of tension in through there. Okay, Stephanie, how would you describe it to people?
My calf?
Yeah, like when I'm working on it, how would you describe it?
It feels tight, and it feels like you're stretching it out when my foot is flexed and you're pushing on it.
Does it? I mean, it hurts, right? I mean, this isn't.
Yeah,
It doesn't. It's not like it's not like it's excruciating though. You're talking to me, that kind of thing. Now, if I push down super hard, or if she's had a recent injury or something like that, or I find just the right spot, yeah, it's going to ramp that up. But like here, now I've got it really nice and trapped, and I'm just trying to push through that. Yep, and then it locks up, and once she'll slide down the table. Yeah, that happens sometimes. This is an interesting thing though, because once you start to do this, the measurement tool for us is movement. So when we have better movement, we can measure that in a couple of different ways. And in her case, we're trying to get her to be able to jump more efficiently. So that way when she jumps, she doesn't have that same type of tension. And for me, you know, from the bottom of the foot up the calf all the way up the leg, that's all kind of one piece. So me working on this section just is, you know, through the movement studies where we said, okay, this is where we see the most happen. It could be in the hip, could be in the hamstring, could be even in the foot. And sometimes we do work on the foot to get that. But there's a couple other ones that we can try. This one's a little bit tender for most people, especially if you get in a tendonitis situation. But it's really kind of cool because we can kind of peel it off. The Achilles off the heel, and whenever that happens, you're kind of working from the outside in. It really works well to lengthen it. These are a lot of the techniques that you'll see happen. Now the next one I'm going to go for is actually the big toe muscle, flexor hallucis longus, the FHL. It's actually like straight down on the fibular head. It attaches here, runs through here, crosses over, and goes to that big toe. So I'm actually going to work on that by moving that big toe and then using my other hand on this near the very connection point, which is up here. She's always going to be a little bit tender with this because she's got that little bit of a problem. So I get that flexed on this side, and I've got good tension, and I've got to get a little bit more depth because I got to go all the way down in there. And Stephanie, you going to live through this one?
Ow.
This one hurts pretty good. You got to get the toe to curl because otherwise it's not going to work. And she can actually already tell, you can actually open up the ankle by doing that. That muscle pushes up from the bottom as it crosses. So that muscle can create a shear effect when it goes up underneath here and goes this way. So that's something we definitely want to work out. So, you know, big toe plays a role in how the calf works and foot works and all that. So it's pretty interesting. And sometimes we can even get it back here, the posterior tibialis. So we'll go from the kind of access it by pushing over that Achilles a little bit, setting that depth. And again, I'm going to back up my hand because it's a little bit of a tension kind of thing. And it's tough, but she can do it. Good. And that's about it. So this is working on the calf. This is manual therapy. This is active release technique. She moves it, I move it. Everybody trying to move that as you treat it. So pretty interesting.